Well, thank you, Mark. Thanks for inviting me. I've been in Miami about in my third year, and Mark is my best friend in Miami, so I'm sort of the token psychiatrist that got brought here to talk about an area that's really dear to my heart. But I do want to start off and say, you know, we up here on the stage, we have a remarkably privileged life to be able to work in the passion that we have, which is to do scientific research and to help patients. And we learn more from our patients than you can possibly imagine. And it's a privilege to sit and hear our patients' life stories. And it's just the best job in the world. And it's humbling. And not only do our patients humble us, but some of us actually have spouses that humble us. So I thought I'd start off with a brief anecdote about me and my wife. Who's not with me. Our daughter is with me. And that I was incredibly fortunate in being elected to the Institute of Medicine of the National Academy of Sciences. That's a big deal. And we were in the hotel room in Washington getting ready for the ceremony, and I had my tuxedo on, and I was, you know, getting ready. And I said, honey, in your wildest dreams, did you ever think I'd be elected to the Institute of Medicine? And she said, you're actually not in my wildest dreams. Yep. So I don't want to take a lot of your time. I do want to talk to you about what we discussed today during my presentation, which is about depression. Depression is a terrible disease. It's not just feeling sad. It's a syndrome in which, if any of you could think about the worst day you've ever felt in your life and felt that way every day for 2 weeks or longer and didn't know why, and you couldn't eat and you couldn't sleep and you couldn't concentrate and you thought maybe life wasn't worth living anymore, that's what depression is. And it's primarily a women's disease. So 20% of women in the United States will suffer from this at least once in their lifetime. And because depression is common and breast cancer is common, the fact that depression and breast cancer can run together shouldn't surprise any of you. And so the question is, what is the impact of depression, this common disease, on vulnerability to breast cancer and the course of breast cancer? And the story has unfolded in a way that is both very exciting and a bit frightening and has tremendous potential. So I'm going to tell you the short version of the story. First, you need to know that, as my predecessor mentioned, depression is a disease of the brain and the body. So there are changes that occur in the depressed person, endocrine changes, brain changes, and in particular, inflammation. And you heard Patrick mention inflammation. Depression is, in fact, an inflammatory state, particularly severe depression. Mark and I are working very hard on what the consequence of that depression-related inflammation is to the progression of breast cancer. Because the data now is not controversial any longer. Depression worsens the outcome of breast cancer. There's absolutely no doubt about it. There's a wonderful meta-analysis that was just published that included more than 200,000 patients. And the fact of the matter is, if you are depressed, your survival time is shortened. And it's not just survival time, it's your quality of life, it's your ability to adhere to treatment, and it, of course, is associated with the terrible risk depression is for suicide. And not to get off the topic, but there are going to be 40,000 suicides in the United States this year, the vast majority of it due to untreated, undiagnosed depression. And now we're beginning to wonder whether depression may even be a risk factor for the development of breast cancer, as it is, for example, a risk factor for the development of heart disease, a well-established phenomenon. And so, as you probably know, coverage by third-party payers for psychiatric care screening is not quite what it is for other disorders. We don't have parity, even though we wish we did. So it's harder for patients to get those kinds of services. Non-psychiatrists are very busy. They often don't screen for depression. But here's the good news. The good news is that depression is a treatable illness. We can treat it with good psychotherapy. The evidence for the effectiveness of psychotherapy, cognitive behavior therapy to treat depression is as good as the treatment of virtually any disease. We have antidepressant medications that are very effective in treating depression, and some of them actually even treat the side effects of chemotherapy. And so you can get the double benefit from a combination of antidepressants and psychotherapy. Exercise, we know, is helpful in the treatment of depression. So I'm advocating very much for an early and aggressive treatment of depression for everybody, of course, who's depressed, but in particular, what Mark and I have a passion about is trying to understand how is it that depression creates a fertile biological milieu for the progression of metastatic disease. And we think that this is something that we can crack in the next year or two. So thank you very much.